Now, one of them is to take off work for the inflammatory phase or the re-exam. Now, this is real important. You want to take the patient off work for the inflammatory phase for at least the inflammatory phase or up unto the first re-exam. Now, that's real important. So it's important clinically. But remember, in the inflammatory phase, the patient will irritate. Whatever they do will irritate and exacerbate the problem. And we're trying to clinically control the inflammation. So that's the clinical reasoning behind not having them do their activities, whether it's work or sports or whatever. Now, there's the financial driver side of this and the support side. So taking off from work is a financial driver, so you want to be aware of that. Taking somebody off of an activity, and mainly it's an activity of like work, hobbies, especially activities where they have to make money for their income, that's work. And we're talking about the importance of secondary considerations in the beginning of care, and we're factoring, the financial drivers, the benefit of the patient, your reimbursement. They all have to coincide. And so what we're really referring to now is the importance of taking somebody off, taking a personal injury patient off from work or their activity. So this could be, it's not just work. If they have a hobby of doing something also, you're going to want to refrain from that, because that's just not going to look good in a deposition or in court where you're taking them off work and now they're playing softball every night. So the reason you want to take them off work, and first of all, let's apply it to, the clinical reason is in the inflammation phase, the more activity, the more inflammation. So that's the clinical reasoning for the inflammation phase. And then it's a financial driver, taking them off work, and it supports their injury. It doesn't look as good in court when you're saying how this person is injured this way and that way, or in a deposition, and you never recommended taking them off work, and that will come up. So the reason I'm putting emphasis on this is to give you some guidelines and considerations on how to get this done, because it's going to be different for everybody. Now, also remember, this also includes if the injury was weeks or months ago. And because oftentimes we don't see a patient right after an accident, like the day after. Sometimes we do, but not often. So remember, there's different types of inflammation. So you have the acute inflammation, you have the chronic inflammatory process. So this person could have come into your office a month, 2-3 months later, 6 months later, and you go, well, why should I take them off work now when they've been working? Well, because they're in a subacute or chronic inflammatory state. If they're having inflammation and pain, and chances are they are, or they would not be seeing you. So they're going to be, or it could be a re-inflammation. There could be a re-exacerbation. So the acute inflammation, that's easy to understand. It could be chronic inflammatory. In other words, their work, or their activities of daily living, or hobbies, are causing chronic re-inflammation, or it could be an exacerbation or re-inflammation. Okay, so that's the clinical dialogue reasoning that they would have it, even if they had the accident, 1, 2, or 3 months ago. Now, here's what is real important: is always ask for the bare minimum off. So if they cannot take off, ask to limit the activity. So whether it's work or hobby or activity, whatever it is, ask to limit the activity that's causing the pain or discomfort. And then the activity to restrict is the affected motion. So whatever motion is causing pain and discomfort, that's the activity that you want to restrict. Now, state the activity and limits. State the activity and the limits. So if it's bending, then state bending. Now remember, this is if the person can't take off work. They say they can't. And we're going to do a deep dive into all these scenarios and show you the sequence of why you want to do this. So state the activity and the limits. And what are the amount? It's the amount and frequency and time off. So that's what you want to state, the amount, the frequency, and that might be lifting. It might be, the degree, the poundage of lifting. Don't lift more than 10 pounds. Don't do it more than 3 times or 5 times per hour, and then don't do it for 3 days. So these are very helpful when you limit an activity. Limit the specific activity, number 1, the motion that causes the pain or discomfort. Number 2 is the weight bearing of the activity, and then the frequency, and then the time. So anytime you limit an activity, those are the considerations that you want to include. Now, anytime you take off for work for an activity, make it short, such as a week to week with reevaluation. So when you take somebody off of work, and so on the first day, generally, I'll say, hey, do you mind if we take you? And I always ask the patient, this is with the patient, in collaboration with the patient. I don't just say, take off work for 30 days, okay? And, if you're like that, you're going to be losing patients left and right. So I always will collaborate with the patient with what they can or can't do, but I want to make sure, that I get this down and that it's documented. It's very important to have this documented. So anytime you take off for work or an activity, make it short, such as week to week, and then base it on reevaluations. And here's why. If you give a patient an off-work slip for, say, 2 weeks, a lot of times you won't see them again until 2 weeks later and they need another slip. So don't do that. That's one reason. But also, you don't want to go for long periods of time because you won't be able to evaluate their progress. That's why you would never say, I'm going to take them off, or not never, but you wouldn't say, I'm going to take you off for a month. You might ultimately take them off for a month, but it might be week to week because of what I just said. So it'll limit your dropouts, them just taking the note and taking a vacation, so to speak, and not even coming to see you. And also to evaluate their progress, to see if you can get them back to work or increase their activities in the amount or frequency. So that's the evaluating of the progress. So document it. Now this is real important. If they cannot take off work because of the fear of job loss or loss of wages, and you have to ask them. And so I'll say to the patient, and this on the end of day 1, I'll say to them, and it'll sound like this: hey, Mary, do you mind if we can we take you off for 2 or 3 days here in a row, just to help decrease the inflammation and the pain as fast as possible? Would that be a problem if we totally took you off work? That's what that would sound like. That's what I'm always going to go for first. Now, if there's any hesitation, and I generally will do like in the first 4 days, we'll take off out until after the report of findings. Then I will reassess after those first 4 days. I will reassess the situation and see if I need to continue having them off, or maybe modify their behavior, allow them to do their work or activities with modifications, and make sure those are documented. And we stated the modifications, whether it's the amount or the frequency. And then remember the time period. Don't make your time periods real long. You won't be able to evaluate, and they'll check out on you. So document if they cannot because of fear of job loss. And so you want to ask them if they cannot take off. In other words, if they can't agree to that, then say, is it a problem with maybe fear of job loss or decreased wages? Is that going to be? And you want to include that. That's real important. So when you don't take off somebody from work, that will kind of hurt your case. It'll hurt the patient and it'll hurt the financial drivers. It'll hurt your case. And by the way, the opposite's not true. The longer you take them off, the better it'll help your case. That's not true also. But not taking them off will be a negative. So you at least want to take them off for the inflammatory phase, the first 72 hours that you're trying to decrease their pain and inflammation, irregardless if it's acute inflammation, chronic inflammation, re-inflammation, or re-exacerbation inflammation, whatever. That's why they're there. So those are then document if they say, yeah, it might be because of job, then state that. Then put in there that you recommended the patient be off, take totally off for, whatever amount of time, for a week. I would never go past a week in getting somebody off. You recommended that they take a week off. The patient stated that they couldn't for fear of job loss, or the patient stated that they could not for loss of wages. See, that's totally okay now. That's not going to hurt the case. Those are real issues, the real people. And so you're still helping the case and not hurting it. Now, so that's the importance of taking time off. So I highly recommend one of the things you do as secondary considerations in the beginning of care is take time, have them take time off. Ask them first, and don't do it for a long period of time. Do it for only the first few days, the inflammatory phase, and then redo it as necessary. So maybe I would take them off for the first 3 days, 4 days, right? And then after the report findings, what I may do is I may modify it depending on where they're at. I may say, let's go back to work, but can we limit your work? Will your work allow you to go back to work with limited restrictions? And that's kind of a classic. And then typically when I do that, I usually like to keep it like that until I do their first reexamination. And so that's kind of a very classic scenario. Totally off work through the first 4 days in the inflammatory phase. And then after the report of findings, day 4, then we'll say, hey, can we just modify your activity? Will your work allow you to work with them? Or because some jobs won't. They'll say, if you have any limited activity, just take time off. And it has to do with many factors. A lot of times it has to do with insurance, that they'll just get reimbursed better if the employee is totally taken off, and it'll go to workers' comp or something like that, as opposed to having them come in. So sometimes it works best for the employer financially just to say, no, just take the whole time off and then come back. So just be aware of that. The main thing there is to communicate with the patient. And whatever, just because they couldn't, don't not document that. That's a huge mistake if the patient says, no, I can't do that, I got to work. And now you have no documentation that you requested it and no documentation that they said they needed to for their wages. That would be a mistake in documentation. Now, that's the scenario. And then, like I said, when you do, if there are limits the amount, the frequency, and the time period. And then there you are. Very short time periods. I would not go more than 1 week at a time. That's what I would recommend. Even if I knew it was the next re-exam, I'm not going to give it to them. And I'll just give you another hint also. I like to give them the note after. So tell you what, can I give you the note after we reevaluate you? And that's more of a practice management consideration, because I don't want to give them the note and then not show up for care. So a lot of times I'll say, hey, can I give you the note after we've taken this time off, or do you need it now? Many times they will need a copy of it now so they can send it to their work or take it into work for the justification. But I'd still like to hold it back to make sure. Now, here's another rule. Anytime you take somebody off work, it's almost mandatory that you treat them every day. It's totally stupid clinically, almost not totally, but it doesn't make any common sense for you to take somebody off work and then you not to be treating them. And that'll come up too. That'll hurt you in court. That'll hurt you in a deposition. So if you're taking them off because of the inflammation or whatever, that's the same reason you should be treating them. And I tell the patient the same thing. So we're going to take you off, and by the way, we're going to treat you those same every day that day to help get that back to normal or decrease the inflammation as fast as possible. So they do not, the real injured patients don't want to take time off and not get treated and just sit around. The people who, some of the malingerers will take your note and then they'll, take a nice little vacation and not see you either. So definitely treat them. Anytime you take somebody off from work day, for any time period, you make sure you have them come in for care. That just makes common sense, as well as fits into the financial driver category and the support of the case, as well as the clinical findings of helping the patient. They want to be treated every day. They don't want to not be treated. Okay, so having said that, that is, in summary, with work. I like to, on the very first day, ask them if it's okay if we can take them off for a few days to help decrease the pain and inflammation as fast as possible and not irritate it. If they cannot, ask them why. Is it due to fear of loss of job or wages? Document it. Is it possible to put limits or restrictions on you? And then document it, and the amount, frequency, and then the time period. And then typically what I like to do is after, give them a note for a few days, then after the report, say 3 days, 4 days, then I like to modify their behavior, possibly get them back to work. And I'll talk with them, say, hey, you think you can go back and do your work? That's how I talk. It's not me only. It's work collaborative. Do you think you can do it? Do you want to do it? Can you modify it, whether it's them personally or at work? And then the last bit of this information is make sure you document what you said. So the preference, whatever your preferences are, make sure you document what you preferenced and why. And then if they couldn't do it, then you state in your documentation why they couldn't do it or why it had to be limited as opposed to no work at all. Make sure you document that. That will come up in a deposition, and I can almost guarantee you it'll come up every time. If you don't take them off work in the beginning, and here you are trying to say, how bad their injury is and support their injury, but you didn't take them off from work. That is really going to hurt you and how you look, especially in a jury.